30 years of alternative medicine mastery. One visionary doctor, Dr. John Salerno, the name that has revolutionized health. With over 100,000 patient visits, he's not just treating symptoms, he's transforming lives. Preceptor at Yale, founder of 12 international centers, Dr. Salerno is bringing world-class wellness to you. When the world crumbled on September 11th, Dr. John Salerno, the medical director for the World Trade Center landfill, stood guard over the health of thousands. He protected workers from invisible killers, airborne chemicals, heavy metals, toxic substances. But his fight didn't stop there. For 20 years, he's been waging war against chronic illness with his own unique IV formulas. From cancer to COVID-19, from Alzheimer's to autoimmune disorders, Dr. Salerno's on the front line. But it's not about fame. It's about you, your health, your future. Don't just treat your illness. Empower your body. The Salerno way.
That commercial cost me a fortune. Do we have the remote? Yes. Do you have it? Oh, thanks so much. Thank you all for having me. Thank you, Christina, for inviting me here, and I'm honored to be here in my home state of Connecticut. Um, and also, since it's a keto diet, I just wanted to mention, I work with the great Dr. Robert Atkins, who really developed the keto protocols that we were involved in even prior to his death. So it's truly an honor to have worked with him. And part of this, as I always do, is devoted to him because I probably learned more with him than I did in all my years of medical school. So it certainly is an honor to carry on his work with keto diets and everything else that we do in New York and in Connecticut. So we'll start with peptides and we'll end with heavy metal testing and detox. Does anyone know what are some famous peptides that you guys could name? You know? Right. Semaglutide, Mounjaro, insulin, which is a big peptide. But the peptides that we're going to go over, and again, some technical issues with it, their peptides are really amino acids. They are between 2 and 50. Interestingly, the FDA has pulled some of the peptides that are bigger, longer than 21 amino acids for some reason. We think the pharmaceuticals now are trying to tweak it and to patent some of the formulas, unfortunately, because they've been very effective. But again, they're between 2 and 20. They're part of hormones and enzymes, and they're part of the signaling molecules for all organ systems and functions of the body. Um, they are Most of the peptides that we're studying have been tweaked a little bit. Some are actually natural, like insulin and glucagon, which I'll go over in a second. But there's a lot of research on peptides ongoing for cancer, for Alzheimer's, and we'll get into that in a couple minutes. The oops. There are several peptides that I could go over, but I want to go over more of the key. And I think actually I missed well, maybe I didn't. Um, and this is an interesting story. So oxytocin, which is a hormone that we use in pregnancy, believe it or not, that's natural, but we also can compound that, and that's used for closeness. Even we're seeing memory issues that we can address with glucagon, particularly nasally, intranasally. But two or three peptides that I've been using regularly, and we're getting some really good results. And again, a lot of these peptides are considered experimental. We don't see any real I've not seen any real downside. But BP 157 is one of the peptides in TB 500. These are peptides that are really very interesting for sports injuries. They produce new blood vessels. Angioneogenesis is what particularly BPC, which is body protective peptide 157. And what that does is it increases essentially regrows cartilage and reduces inflammation, regrows ligaments. TB 500 is similarly does that, anti-inflammatory. And then we use something called GHKCU, a copper peptide, which is great for collagen, anti-aging, production of new skin cells, elastin. I want to tell you a story of how I really got into the peptides. We have two Dachshunds, two dogs, one of which is older and smaller. Our younger one, unfortunately, is a long Dachshund, and we never realized that we needed to make sure he didn't jump on couches and didn't go up and down stairs. Unfortunately, again, we didn't realize he became paralyzed. He had what they call IVD, vertebral disc disease, or actually a rupture of his disc, which impinged the nerve roots. So he wasn't walking, the poor thing. And we took him for an MRI and we took him to the vets, and the vet said, no, he won't walk again. So you're going to have to get used to having him in a trailer, a wheeled trailer. It was just a sad thing because it was a young, vibrant dog. I said, we can't live with that. We're not going to. So I use BP 157, TB 500. I injected it every day into his joints. I used the beamer on him. I used red light therapy. Within 3 to 4 months, he was back like nothing happened. The vets were shocked. I said, why don't the vets call me and say, what did you do? With something they can implement for a lot of, because they were going to do surgery, but the risks were too strong, and the outcome was not guaranteed at all. But anyway, he's fine. He's walking around, hopping around, of course, not jumping up and down stairs, but we're careful with that. But they're very powerful. They are being studied. These peptides really do make a difference. They're going to be implemented in a lot of modern practices probably within the next few years for sure, even in traditional practices, because they are showing some tremendous results clinically. And we're pretty much doing peptides on a daily basis. Again, let me go through these. The BP 157 that helped my dog, that promotes new blood vessels, which then would allow for increased blood flow to the damaged areas. And also, these areas then can produce collagen, which is what happened to him. His collagen was totally replaced, and that area of inflammation that was impinging on his nerve roots were completely reduced. Again, TB 500 stimulates actin. It rebuilds damaged tissue, particularly muscle. Uh, these peptides, particularly those two, are definitely more effective by injection, although they are available orally. The problem with it, they have a very short half-life, and a lot of the issues with stomach acid will denature these. They won't be absorbed as readily. So we generally stick with injections on these. Again, though, they are available by orally. There's another peptide, CJC, that actually increases growth hormone. Salac is a modern neurotransmitter peptide. We've been using that for cognitive issues, Alzheimer's, patients that are at the beginning stage of Alzheimer's, and some good results with it. Again, that's generally better provided by injection, and if anyone's interested, I'd be happy to go over how we do that, but it's generally at least 3 or 4 times a week by injection. And the copper peptide, the other one that we used on our dog, GHKCU, is also used as a skin cream, and it really is part of an anti-aging protocol. Again, it produces collagen, elastin. It's applied topically too. It's also used by injection. A really effective peptide. Really enjoy it. Um, by the way, that Selenac, the peptide that we use for memory, also increases dopamine, epinephrine. We use it also in anxiety and depression in a lot of patients with good results. So again, peptides are used in all diverse areas of medicine for diabetes, for tissue healing, as I just went over, weight loss, the semaglutides, the Mounjaros, the Ozempic are the pharmaceutical version of these peptides for weight loss. And of course, they've been extremely effective. And we're seeing parameters like cholesterol, triglycerides, and lipid panels improve dramatically with it. Again, you have to go slow. Patients can get nauseous. We give sometimes an anti-nausea medication for it, but they do very well. Obviously, it's been a game changer. We're not only with weight loss, but with lipid parameters and just getting patients healthy. Again, you have to go in lower doses and moderate over time. An interesting, this is epitalin is a very interesting peptide. It was developed in Russia, but it tends to increase telomeres. You know what that means? The lengths? So it's anti-aging, essentially. So we find that as we get older, our telomeres levels, the length of them will diminish and increase the chronic issues with the chronic diseases. But we're lengthening telomeres. So the idea is it should be preventing a lot of chronic disease. A lot of research going into epitalon, which we truly like. The Selenac, the cognitive support again is for Alzheimer's and dementia and depression, anxiety. So, how do we deliver these peptides? Most of the peptides are given by sub-Q injection. For certain muscle injuries, we may go a little bit deeper, but we will give it generally in the stomach or in the area of concern where there is damage, like we did with my dogs, or with some athletes for shoulder injuries, for back injuries, etc. Um, as I said, the growth insulin, of course, is generally given by IV and or IM injection intramuscular. The topical peptides like the GHKCU, very popular. You can get that over the counter. Great for skin repair and for fine lines and wrinkles. Got a good high concentration of it, very little side effects. The challenges, though, with peptides is really the issue is that you have to inject them for the most part. If you don't, you're not getting the efficacy that you would get typically by injections. The orals can support for some degree, but you really have to inject most of them. Again, they are available orally, but in high doses and short half-life makes that a little bit of a challenge. The future of peptides really again is in cancer treatments, which is very promising because there's peptides that stimulate our own immune function, and there are peptides that are directed, exactly against cancer cells, not affecting our healthy cells. That's in research. The Alzheimer's Selenac and the Epitalin for neurocognitive issues, again for prevention and treatment of Alzheimer's. And for patients that want to prevent the onslaught, it's really a good idea to get involved with your physician with those peptides, particularly if there's a family history of Alzheimer's or dementia. And the peptides are going to play a role in the way we individualize medications and or treatment protocols away from medications and more towards these natural approaches to health prevention and healing. So, in conclusion, we're very excited. It's a whole new area of medicine, showing a lot of promise. A lot of research is getting involved with it, and there's ongoing studies continually. And I think in the next 3 to 4 years, this will be part of everyday practices. So we're very, very excited. You have a question? Yeah, there are, a good question. There are peptides that stimulate the production of stem cells and growth hormone for that matter. There's quite a few of them. So you can increase stem cells with certain peptides, semirelin, ipamorelin, which again, mostly by injectables, but they will increase stem cells. Epitalin also, the stem cell, the peptide that is for lengthening the telomere. But yeah, that absolutely is part of a protocol that we use for our anti-aging parameters. Any other questions on peptides? Yes. There are peptides that are being used for that, for example, for prevention of atherosclerosis and for treatment for mild to moderate amounts of plaque development. Ipamorelin, semirelin, for example, are two that come to mind. And the anti-inflammatory ones like BP 157, they're showing that some of that would actually replace some of the plaque buildup. So there may be in the future ways to reduce the amount of plaque with the peptides. But again, injectable is really the way that needs to be done. Yes. That's a good question. Yeah, you know what we've been doing? You come and see me for the first treatment. We would show you how we would inject it, and then a lot of patients can do this on their own. They can inject it because it's not we don't, it's an insulin needle. Doesn't go deep. It's similar to how you would do, Ozempic or Mounjaro. So it's painless. But we would show you how to do it and what areas you would need if we were treating injury. If you were doing it just generally in the stomach with a very small, you wouldn't feel it, insulin needle, 2 or 3 times a week. But we generally would give you a supply that you can do at home and continually supply you 2 or 3 times a week till symptoms resolve, then maybe a maintenance once or twice a month. Yeah. Well, that's easy because you could use that as a cream, but that you'd probably do once or twice a week too as an injection, and that would go right in the stomach. There's a pill version of it too, but again, we're not seeing the efficacy. But if you do higher doses of the oral version and do it every day, you probably would get some results. Combining that with the cream version for anti-aging. Yeah, you're welcome. Any other questions? Yeah. It depends. Yeah, it depends. If there's sports injuries, chronic issues with tendons and ligaments, it's probably at least 3 to 4 months. And that's with maybe, depending again the severity, but likely daily injections of the peptides, BP 157, TB 500. They come combined. And again, we generally would start our patients, show them how to do it, and then you'd go home with the syringes and with the peptides. Not yet. We're looking into it. Yeah, not yet. But New York and Shelton and Southport. Yes, we do. In fact, if you write me, I will show you some trials related to the peptides. And again, it's an ongoing issue. And when we purchase these peptides, it will specifically say for investigational use. So again, they're not really approved. We can get them, but the studies are pretty profound. And because we do a lot of things outside the box per se, as long as we're not doing any harm, we've seen some very good results. You're welcome. There's a few of them. Yeah. Right. Yeah, I think that was ipamorelin. The problem is it's over 21 amino acids, and for whatever reason, the FDA said you can't compound or sell. Or I think again they're tweaking it so that they can get pharmaceuticals involved because it's pretty profound. And again, they work. Like they've done with Mounjaro and they've done with which is semaglutide. That peptide was around, they tweaked it, and now it's a multi-billion-dollar uh, pharmaceutical. And I think they're doing that with the rest, unfortunately. A lot of the peptides over, for whatever reason, I don't know why they picked over 21 amino acids to be banned, which ipamorelin was, but we'll soon find out, I'm sure. Any other questions on peptides? Yeah, over there. Okay. Oh, to my right. Okay. Yeah, go ahead. For overall health, probably I would do Semarelin, depending on the age of the patient. But yes, that's true, and that's still available. They increase growth hormone, they burn fat. I like the BP 157 GHKCU and the TB 500, I think, for general overall health, wellness, anti aging, in addition. Yeah, that's not a bad peptides. I don't have as much experience. We had a hard time finding that. But again, that stimulates growth hormone, immune function. And there's a few like thymosin is great for patients, where we've had issues with COVID and infectious disease. So this there's quite a few again, but preventative and for treating anti-aging and wellness. I think my top three are the ones I mentioned, or maybe the top four. No, I haven't had experience with them yet. Again, it's hard for us to get it. New York, a lot of it is banned, believe it or not. So a lot of it has to be shipped to Connecticut. So it's become a problem, but we're working on that. Okay, you're welcome. Any other questions on peptides? Yes. Yeah.
Um, thanks. Do you do any work with hormone replacement and
Oh, yeah, we do a ton.
do you?
Yeah, we do. So we use estradiol or biastri, progesterone, testosterone for women and men. Um, we do oxytocin, we do DHEA, pregnenolone. We measure, we make sure we individualize treatment protocols. But we even use hormones in very young women that are still menstruating with very good results. So yes, we do a lot of that. Yeah,
Just to follow up on Michelle's, but there is an age cutoff, right, for women that
no,
where you could not do HRT.
not true. I had a woman, this funny story in New York. Her son called me and said, my mom is 92. She's starting to show signs of aging. I said, just starting? I said, you don't need my help. Anyway, she asked, he said, listen, do whatever it takes. I'll pay for it. I put her on estrogen. I put her on progesterone, testosterone, DHEA, pregnenolone, growth hormone, which was expensive. Had a personal trainer that he had paid for. She lived to, I think, she just passed away, 102. But she was vibrant till the last year. She was still out in Central Park with a personal trainer. It's crazy. But yeah, we've treated every age group.
I asked an endocrinologist I had to see because anyway I had some surgery, and I asked for HRT, and she said, at your age, if I gave you HRT, you would have a heart attack. So that stayed with me, and I thought, oh my goodness, I
Yeah.
thought there was an age cutoff.
There's one thing to give you information that's pertinent and that they have read about, know about. It's another issue to give you information that they don't really know about and have no experience doing, and putting the fear in you. We've never seen a heart attack in any of our patients on BHT, no matter what age.
Does that give you estrogen?
Of course.
Okay, good.
Estrogen, testosterone, progesterone, whatever you need.
How do you know where the weaknesses are in somebody's body? I mean, this is all blood work.
We do a lot of blood work. Kim will tell you, my registered nurse, we do about 16 tubes of blood typically. We do whatever we can that's available, that's covered under insurance, and including tumor markers. We do all the adrenal tests. We do heavy metals in the blood, of course, your lipids and your renal function, but it's very detailed. We check for things like troponin and which unfortunately from vaccines would indicate issues with myocarditis, which we've seen from the COVID vaccines, and something called D-dimer, which indicates clotting, and we do see that from the vaccines, unfortunately. But we do the whole panel. We do everything that we can.
And is this insured?
Most of it, yeah, 95% of it is covered. In fact, almost 100%. We work with one lab, and I've been doing it with them for many, many years. So what they'll do is they'll waive some fees that aren't covered depending on your insurance because we give them such a high volume of labs. But yeah, we want to really get an individualized treatment, so we want to get a lot of data and info. Yes. Oh, yeah.
I don't need a microphone. Thank you. I'm loud. No, no, thank you. Oh, oh. How long does it take to get in?
To my office right now, we have we, we can get you in pretty quickly. We have a we have two nurses, we have a PA, a nurse practitioner. We have two nurses. So if we have to do IVs, we just opened up a few more days, particularly. But you'll get in pretty quickly. Any other questions on pet? Yes.
Mostly in the purview of integratively oriented physicians and practitioners versus mainstream medicine
For the
at this
most
point?
part,
Yeah.
except Ozempic and tirzepatide, Mounjaro. But for the most part, it's more in the alternative realm. Definitely. You could find a lot of practitioners, I think, right now that do practice that, like she had said. But which is great. You need to see, and it's evolving, but it's rapidly evolving. Yeah. Yes, it does. It does. But natural. We don't use medication.
Wherever she has trauma,
Right.
where she fell, or a burning seems to be like this
Like a
ongoing.
neuropathy, yeah.
Yeah.
We do treat that with peptides. We also treat it with something called alpha lipoic acid IV. You can try it with her orally, which should help. And then there's natural. We use MSM. We use something called DMSO, all intravenously, that would help. They're natural anti-inflammatories. So, but certainly, and the peptides would certainly help. You're welcome. Any other questions on peptides? Yeah.
You mentioned the drug Talent. So after implementing for people who have dementia and other age cognitive delays, how soon do you see results in these
You can see
patients?
results within 3 to 4 months. What I say with Alzheimer's is the earlier you can catch patients, the better. And that includes issues which we'll talk about next with heavy metals. You got to get them out of the system before they do damage, and a lot of that is difficult to repair, particularly as they get older. But definitely there is involving research, and we do see some great results. The earlier the better. Peptides, chelating, etc. Any other? Yes. Yeah.
Promising peptides with the more chronic diseases like muscle dystrophy, which are debilitating. Do they show any promises and improvements for the patients?
Oh, we've seen some great improvements with the peptides that I.
It's not curing; it's just helping.
No, no, they're curative because they regenerate cartilage and ligament, and they're anti-inflammatory. So you can affect cures, no question. Again, it's a matter of knowing the dosage and knowing you have to inject it at the site typically, not orally with the peptides. 90% of the time for those type of injuries.
But there's a hope still.
There's a lot of hope. Yeah. Anyone else? Yes.
Just on the Celank, if I'm pronouncing that correctly.
Right.
Do you think there are indications for addiction?
Yeah, absolutely.
Because,
Because it works on dopamine.
yeah.
And so we use NAD and too intravenously for that. I use glutamine IV but absolutely that's the evolving research on that where it increases epinephrine, dopamine, and yes, it would work on addiction, particularly in theory.
Addiction is a key word here. Would it help with the food addiction?
Absolutely. Well, the tirzepatides, the semaglutides help with that. And by the way, they also help with addiction, even with drugs and alcohol. So they
So,
work in the same areas. So you can combine a few peptides that definitely would help. And those are once a week injections.
so they're not just removing the hunger, or they're taking out the anxiety.
Absolutely. And
Like
the craving component
the
of the drug, which we've seen, and Kim would be my witness, but we've had a few patients that were alcoholics, some drug addicts. We also used NAD, but they've been on some of the peptides, particularly the peptides for weight loss, and they've done extremely well. They come in once or twice a week for high dose intravenous NAD also, but
And
it works.
NAD is for the anxiety or the
And so
addiction.
for the addiction,
The,
it also has other benefits like certainly anti-aging. We have a young kid, very young boy that had kidney failure as a poor thing. I think he's 10 or 11 now. But we've been giving him IV NAD, where it's very prevalent in the kidneys, and his kidney functions are coming back pretty rapidly. He's doing great. But NAD is another whole nother topic for itself, but a great nutrient. Again, a lot of research behind it.
well, for those of us who are trying to lose weight or fight that fight, the fact that not just take away the hunger, the real hunger, but the anxiety, because there's a huge head component.
Yeah, then you would probably do well with at least one or two peptides, for sure, for that. But it works.
Good.
Any others? Yes. Oh, any other questions? We're good? Good with peptides. All right. Let me get to another really important topic and what I end up doing a lot of. We're probably the busiest chelating center, maybe in New York particularly, but here in Connecticut too. Maybe in the U.S. We do a ton of IV chelation. We test routinely as we do lipids and cholesterol for heavy metals because it's really an important topic that's missed in traditional medicine. I don't know if there's any traditional physicians that really measure heavy metals, but they're so impactful, you know, it's an issue. But I'll go through this. I know we don't have too much time, but oh, we're done. Okay. Gee. Anyway, real quick, aluminum, cadmium. Aluminum is. Do you know what aluminum can? Where do patients get aluminum from? Does anyone know? Right. Deodorants, antacids, aluminum pots and pans. Cooking. You got to really check your pots. You don't want aluminum based pots and pans. Aluminum foil that we probably all use is really, you should not, because we'll measure it and we'll see the high amounts of aluminum. Aluminum has been really implicated in Alzheimer's, no question. And we'll see that pretty routinely. Just going really quickly, cadmium, we see a lot of cadmiums from cigarette smoke, chocolate, believe it or not. It's very carcinogenic. It has to come out of your system. We measure it. We see a lot of it. We see a lot of course, mercury. Mercury, where's mercury coming from? What's that? Fish. Mostly fish and from fillings, right? Fillings. So mercury levels, we see routinely high levels. I'll tell you a real quick story, and I guess, are we done? We're pretty. Okay. So, Tony Robbins was my patient about 3, 4 years ago. He used to come in. He didn't come in. He would want us to go to the Four Seasons Hotel and do IVs on him. So I go with my nurse at the time, and his wife pulled me aside in a little tiny room. Here's a billionaire with a room about the size of, I don't know, like a closet. But I'm sitting in there. He was on the phone. He got off the phone, but his wife pulled me aside and said, Doc, please get a history of my husband. He's not really feeling well. He sweats all the time. He's very gray, and we don't know what's going on. And he's stoic, and he doesn't want to get checked. I said, all right, I'll sit down with him. I gave a quick history, we got a quick history from him, but I said, Tony, what do you eat for breakfast, lunch, and dinner? He said, for breakfast, I have tuna salad. For lunch, I have a swordfish steak. And for dinner, I have a tuna steak. I said, Tony, who gave you that advice? You give great advice to everybody else. And where'd you get that advice from? He said, why? He said, those fish, I told him those fish have the highest amount of mercury. He said, please test me, my wife, my assistant. The next day, literally, the lab called me and the Department of Health in New York. It was the highest level of mercury they had seen in blood samples, and I had seen. He probably would have died within a couple of weeks or a month. It was actually poisoning. It wasn't even toxicity. It was like eating thermometers. But he had been doing it for years and years, and he really was sick. He looked ill. He was just gray. He was sweating when I saw him. Anyway, he detoxed. Long story short, he's doing great. Never eating fish again. So you can't blame them. But I guess I should finish. I don't want to interfere with other lecturers, but you have to be careful with that. Um, you could have tin in jewelry, which we measure. The idea is to get tested, so we test it by giving chelating agents, which draw out the heavy metals into the urine. It's the best way to test because it tells me what's stored in your body tissue. The blood will only tell me your exposure over the last couple of months. But we combine those two tests because are you recently exposed or is this something from back a lifetime potentially? And we do a heavy metal challenge. That's the more important test because it could be stored in kidney, brain, heart, liver, etc. It's a big issue.
Thank you, John. We appreciate all your
Thank
information.
you
It's
so
very
much.
valuable. We're
Thank
going to
you.
introduce Christina back to the stage. Thank you so much.
Thank you. Thank you.